What up, folks? How y'all doing? Sorry, I don't have my light all set up. One of the perils of going live, once you go live, you can't go back. But hey guys, thanks for joining me nonetheless. Give me one moment. Okay, maybe I can look a little bit organized. Thank goodness for editing. Great. Hey guys, Dr. Dan. Thanks again for joining me. Wild Wednesdays, hump day today, huh? Great. Hey, look, cheers. Here's to that. If y'all want to fire it up, good for that too. So what we're going to be talking about today, guys, is prescription medications and cannabis, and specifically how to really address the idea of over-medicating with prescription medications and finding a substitute and a way out of the prescription medications hamster wheel. I'm not getting the light. I want to. It's just annoying trying to do this podcast, do this YouTube thing, and not having the light set up how you want to. Anyway, folks, again, Dr. Dan, thanks again for joining me. Don't forget to like and subscribe to the channel. Share my videos with your friends if you like all that good stuff. Anyone who might be curious about cannabis knowledge. Well, getting back to the subject at hand, folks, getting out of the prescription medication hamster wheel, the reason why this is important is because, over time, these prescription medications, they have decreasing benefit, all right? A lot of the medications that we prescribe in the outpatient setting, they're really good to help someone just sort of buy some time while they look for a more sustainable method. So I want to focus in on that. It's really just a plug to get you from point A to point B. But really, it's just a short-term solution, not a long-term solution. All right, and that's where cannabis comes in. I know cannabis has long been touted as a gateway drug to doing more harmful activities and opening up someone to doing harmful habits. And I don't really like to endorse that too much because I don't think it's true. I don't think it's accurate. What I do believe is probably closer to the truth is that cannabis is really a good bridge to getting someone out of that cycle where they're taking all of these medications, essentially mindlessly, and being able to use something that can really relieve their symptoms and give them a higher quality of life and more relief without that toxic insult. And that's really the cost of your prescription medications, okay? Because these are artificial things made in a lab, all right? These things that we take for, be it for pain or for hypertension or type 2 diabetes, all of these things that we prescribe in the Western medicine arena, these things are made in a lab, therefore artificial. They don't come out of the ground. So intuitively, that tells us already that this is probably not a thing that's made for our kind of unique human physiology. And that's where cannabis comes in, because cannabis is exactly 100%, no doubt about it. Bring up this idea of cannabis gateway medicine, a natural plant medicine, out and away from the bondage of prescription medications. All right. So for those of you who are curious about cannabis and what it can do and if it can possibly help you, check out some of my other videos. All right. Because I talk about a host of different presenting complaints, be it fibromyalgia, chronic pain, depression, PTSD, cancer, I think I've spoken about before. So I talk about those different presentations and how cannabis can possibly help with them. Neuropathy is another one. Arthritis is another one I've made a video about. So I make videos regarding a couple of different presentations, but all of them sort of converge on the same point, because there's a choice of what you can do in terms of how you treat your symptoms. Doctors have a choice in terms of what they can choose to prescribe to patients as well. And really, at the end of the day, The best solution really hinges on the individual and what they're looking to get out of it. All right. And if someone is looking for something that they can do long term, sustainably, without decreasing benefit over time, cannabis oftentimes will be a better choice than other medications. Is it prescription medications specifically? Is it the best choice all of the time? Probably not. Okay, probably not. I think the great majority of the time, I think it's a really, really good option and probably a better option than prescription medications. But each patient can vary. Their internal makeup, their internal chemistry can vary. Their values can vary from one person to another. So, whether cannabis is the best choice is really going to depend on the individual. But the one thing that does remain is that the endocannabinoid system is the clue that our bodies are made to receive this stuff. Okay, our bodies are made to receive it, and our bodies react just fine, and our physiology reacts just fine and is even better when we dose cannabis products. The whole function of the endocannabinoid system is to bring us back in balance. And that's the thing that the ECS does that these other medications don't do. These other medications force our physiology to a different set point, but they can't keep us there for any period of time because these are not physiologic things, these prescription medications, okay? So if we want to live in the world of reality where we can do something again and again and again in terms of a treatment option, cannabis seems to be a better choice. And it from what I can see from my observation, it's really helping people to reduce the amount of prescription medications that they take on a day-to-day basis or on a regular basis, period. So that's something very important to remember. If folks are looking to reduce their prescription medication load, cannabis is definitely something that you might want to eyeball and at least look into, to just introduce your conscious to the whole field of natural medicines. Cannabis is but one of them. But once you get yourself oriented in that direction, then attuning your mind to looking at those different options that might be available, you start to it starts to become more of your regular practice. Okay. And I think having something that's so instant gratifying, people like instant gratification. With cannabis, you get pretty much instant gratification in terms of symptom relief. So that's a good thing. I like to be able to add a reward to things so that people can feel incentivized in taking them. So, that's the reason why I bring up cannabis as the gateway drug out of the prescription medication hamster wheel. So, I know a lot of you guys can attest to this, but really I put this video out for those of you who might be on the fence and are really just curious. Okay, this is a good way to get yourself started to the road of long-term health, long-term wellness. All right. So cool. Hey guys, thanks for checking out the video. I didn't want to over inundate you guys with too much information on this video. I just wanted to raise some awareness, and I think I'll make another video subsequent to this just to talk about this topic a little bit more. But as far as getting out of that cycle of prescription medications, cannabis a really, really good option, a safe option, a sustainable option. So definitely worth a look, okay? Guys, listen, thanks again for tuning in. Don't forget to like and subscribe to my channel, and feel free to share. I love sharing good videos that I like. And if you like this video, give it a thumbs up. Feel free to share to your favorite social media channel. All right, guys? Love you guys. Dr. Dan, out.